Here is how I would actually use an Agentic operating system in my Atlanta clinic next quarter. Not in theory, not in a research paper. In a real 45 patient a week regenerative medicine practice with real PRP protocols, real BMAC procedures, real DEXA scans, real imaging review, and real patients who expect a human physician and a personalized plan. This is the episode no one else can record because no one else is doing exactly what I do in exactly the way I do it. So let us get into it. Let me start by making the case for why regenerative medicine, specifically a practice like Pravida, is actually the ideal context for piloting an Agentic clinical OS. This is not self-promotion, it is a genuine clinical operational argument. Regenerative medicine sits at the intersection of several disciplines that standard clinical IT was not built to support. Musculoskeletal pathology, cellular biology, injection technique and procedural protocols. Patient selection based on complex, multidimensional criteria. Longitudinal outcome tracking that spans multiple injection sessions over months or years. Protocols that are highly individualized to the patient-specific pathology, anatomy, biology, and activity goals. That combination of characteristics, cross-specialty, highly individualized, longitudinal, evidence frontier, makes standard EHR workflow especially painful and agentic orchestration especially valuable. Every place where the EHR's assumptions fail is exactly where an agent's flexibility shines. I also want to be honest about the business case, because I think the healthcare AI conversation sometimes refuses to acknowledge it. Pravida is a small private practice. Every minute I spend on documentation is a minute I am not spending on patient care, on procedure development, on clinical education, or on business development. For a specialty practice operating outside of a large health system, without the operational support infrastructure of an academic medical center, efficiency is not an optimization, it is a survival consideration. An Agentic OS that compresses my administrative overhead by 30% does not just improve my quality of life. It changes the economics of what the practice can do, how many patients we can see, what services we can offer, what educational content we can produce, what partner relationships we can maintain. The business case and the clinical case are the same case. I am going to walk you through the Pravida clinical workflow in 5 zones, and for each zone I will describe the current state, what we do today, and the agentic state, what changes when an Agentic OS is running. This is the content behind the Pravida AI operating system map that I'm releasing as a free download with this episode. Zone 1, patient intake and records aggregation. Current state, a new patient submits intake paperwork, health history, symptom questionnaire, prior treatment history, which is reviewed by a medical assistant and entered into the EHR. Prior records are requested via fax or portal and reviewed manually by the clinician before the consultation. Agentic state, the intake agent receives the patient's responses, structures them against a Pravida-specific clinical profile, current complaint, relevant musculoskeletal history, prior regenerative treatments, current medications and supplements, activity level and goals. Simultaneously, a records retrieval agent queries any connected health record systems for relevant prior imaging and labs. Before the consultation, I have a structured clinical brief, chief complaint, relevant history, prior record summary, initial differential ease that has been assembled automatically. The physician's role in this zone: review the brief, identify any gaps, flag any prior records that need direct review. That review takes 5 minutes instead of 20. Zone 2, pre-procedure workup. Current state, for PRP or BMAC candidates, I order a specific set of labs and imaging, CBC, with differential comprehensive metabolic panel, inflammatory markers, relevant musculoskeletal imaging, and if indicated, DEXA for bone health and body composition. Each order is entered manually. Results are reviewed manually when they return. Agentic state. The workup agent generates the appropriate order set based on the procedure type and patient-specific clinical flags, automatically from the clinical profile. When results return, the analysis agent structures them against the Pravida protocol criteria. Is the platelet count in the optimal range for PRP? Are inflammatory markers elevated in a way that might affect the treatment timeline? Does the imaging confirm the specific pathology that the injection will target? The agent presents a protocol recommendation, PRP versus BMAC, volume, concentration, target anatomy, with the evidence basis and the relevant contraindication flags. I review it, decide, and proceed. Zone 3, procedure documentation and real-time support. Current state during a procedure, an ultrasound-guided PRP injection, for example, I am simultaneously performing the injection, talking to the patient, and mentally tracking the procedural parameters that need to be documented. Post-procedure, I dictate a procedure note covering approach, guidance method, anatomy, injectate preparation, any complications, and post-procedure instructions. That dictation and cleanup typically takes 15 to 20 minutes. Agentic state. A procedure documentation agent receives my real-time verbal narration during the procedure, anatomy, guidance confirmation, injectate preparation, patient response, and generates a structured procedure note in real time. Post-procedure, I review the generated note, make any corrections, and sign. Documentation time, 2 to 3 minutes. The procedure note agent is also tracking compliance with Pravida's standard work, our internal protocol checklist. If I deviate from standard E, for instance, if I modify the injection volume based on the patient's anatomy, the agent notes the deviation and the clinical rationale in the record automatically. That is quality documentation that protects the patient, the practice, and me. Zone 4, patient education and follow-up coordination. Current state, after a procedure, a care coordinator prepares and sends patient education materials, post-procedure instructions, activity restrictions, timeline for expected response, what to watch for, and when to call. Follow-up visits are scheduled manually. Outcome tracking is done at scheduled follow-ups with a questionnaire administered by a medical assistant. Agentic state. The patient education agent generates personalized post-procedure instructions based on the specific procedure performed, the patient's activity level, and any relevant clinical flags. A follow-up coordination agent initiates the appropriate follow-up protocol. Scheduled check-in at 2 weeks, outcome questionnaire at 6 weeks, re-evaluation imaging if indicated at 3 months. The outcome tracking agent aggregates responses into the patient's longitudinal outcome record, automatically flagging any responses that suggest an adverse response or a trajectory off the expected recovery curve. Zone 5, protocol optimization and practice quality management. This is the zone that most practices are not thinking about yet, and I think it is the highest long-term value zone. Current state, Pravida tracks patient outcomes manually. We know which patients did well with PRP, which did not. Agentic state, the practice analytics agent continuously aggregates outcome data across all procedures, by indication, by protocol variant, by patient demographic and biologic profile. Over time, it identifies patterns. Which patient profiles respond best to BMAC versus PRP, which protocol modifications correlate with better outcomes, which baseline characteristics predict non-response. That is a systematic feedback loop from clinical practice back to protocol design. It is the kind of analysis that takes a research team months to do manually. An Agentic OS does it continuously in the background as a natural output of the clinical workflow. This is the core of what I mean by a medical operating system. The Pravida AI operating system map is a one-page visual that shows all 5 workflow zones, the agent types in each zone, the physician review gates, the data flows, and the feedback loops. I designed it as both an operational planning tool and a conceptual framework. You can download it for free. The link is in the description below this video. I am releasing it as a practical contribution to the clinical AI conversation, as a working document from a practicing physician trying to think through this concretely. Act 4. What this changes for Pravida's business. If we implement documentation automation, Zone 3, it's across 25 procedure visits per week, and we compress documentation time from 20 minutes to 3 minutes per procedure, that is 17 minutes per visit. 25 visits, that is 425 minutes per week, over 7 hours of physician time recovered. 7 hours per week. That is not time I am going to spend scrolling my phone. That is time I can reinvest in seeing additional patients, in developing new protocols, in clinical education like this series, or in the business development work that grows the practice. Annualized, it is the equivalent of adding a full clinic day to every week without adding overhead. I want to be specific about what I would not automate in the current state of this technology. I would not automate the treatment decision. The agent can present a protocol recommendation with supporting evidence and contraindication flags. The decision to proceed is mine. The physician in the loop is not optional, it is the point. I would not automate the patient consent conversation. Informed consent requires a human physician to explain the risks and benefits, assess the patient's understanding, and answer their questions. I would not automate the imaging interpretation. Imaging is a tool in the clinical reasoning process, not a standalone answer. I would not automate the flag response. If the outcome tracking agent flags a patient's response as off-curve, that flag goes to me. These reflect the places where the complexity of the clinical judgment, the legal accountability, and the patient relationship are concentrated. Those are the parts of medicine that need to be human. Everything else can and should be orchestrated. The Pravida AI operating system app is live. Download it, use it, adapt it to your own practice context. This playbook is not science fiction. The architecture is clear, the clinical logic is sound, and the business case is real. Next week, I am going to take a turn in a different direction. Episode 9 is about the safety problem, the failure modes, the cases where agentic AI should not be trusted, and the 3 things I will never let an agent do in my practice. I'm Dr. Trevor Turner. This is the Medical Operating System.